Hello, I'm Gilad Cohen, and with me is Laura Doyle. We are co-chairs of the physics track for the 2021 ABS meeting. We have what I think is an exciting program, and we wanted to share some of it with you today. Um, so we have all heard about many advancement and in brachytherapy, and we thought that it is probably getting to be just about time where we can start actually dabbing and trying some of these out in a clinic. And so, in the sessions that we have prepared, we are discussing some of these new techniques. The first one will be about radiobiology beyond EQD2, the nuts and bolts of implementing biological models in a clinic. We have great speakers. The first one will be Jay Chen, who will give us a background and theory of radiobiology for the brachytherapist. Um, we will follow that up with the what we have all been doing with EQD2, which is the GYN experience. Uh, so Dr. Doreen Toder will talk about his GYN experience implementing biological models. And then I thought that we can try to dream a little bit and see if we can implement uh, some biological models to ocular brachytherapy, and Dr. Chris Dufell will talk about that. Laura, do you want to introduce the second session?
Yes, thanks, Gil. We're really excited about all of our sessions. So to describe session number 2 for the physics track, we're going to be going beyond TG43 and diving into the nuts and bolts of implementing model-based calculations. So as we all know, TG43 has been synonymous with brachytherapy dose calculations and brachytherapy treatment planning systems for many years. So in this section, we have a trio of speakers lined up to discuss moving beyond TG43. In the first session, Mark Rivard is going to make the case for model-based dose calculations. Next, we'll have the honor of listening to Luc Ballou talk about the benchmarking of Monte Carlo code. And finally, we'll get a practical example of Monte Carlo-based treatment planning systems from Shirin Enger. Sending it back to Gil to describe session number 3.
So for session number 3, we called it "You Actually Do This." This is a collection of topics that we thought would be of interest to all of us and you, hopefully. The first one has a lot to do with our experience with coming out of COVID too. We'll talk about the virtual school. Can brachytherapy education go virtual? This will be introduced by Toron Lee and Neil Tong from University of Pennsylvania. Dr. Richardson will talk about lutetium-177 in radiation oncology departments. And we'll wrap it off with Dr. Tarun Potter, who will talk about current status and future direction of robotic assistance in brachytherapy. This certainly sounds like a really exciting program. I think I should register. What do you think?
Yeah, I agree, Gil. So in addition to the 3 exciting presentations that we have put together, we encourage you to join us for the physics proffered papers and physics snap oral sessions. We want to remind you that all of these sessions will allow for a live Q&A, and a poster session on the initial night will mimic the in-person meeting environment. This will allow users to pop in on one-on-one with the authors, or even mini group sessions to discuss the poster topics with the authors themselves. In a year filled with challenges, Gil and I hope that you'll take a few hours out of your day to join us at the annual ABS meeting this year. This will provide a platform to engage with other members of the brachytherapy community and keep the tradition alive of sharing and learning from each other. Look forward to seeing you.
See you all there. Thank you.